Hello and welcome to Changing the Odds, Systems Leadership for Equity in Queensland. My name is Laura Barnes and I'm Principal Policy Officer Equity at Health and Wellbeing Queensland. Health and Wellbeing Queensland respectfully acknowledges the traditional owners and custodians of the land from across Queensland. We pay our respects to the elders past and present, for they are the holders of the memories, traditions, the culture and aspirations of Aboriginal and Torres Strait Islander peoples across Queensland. Health and Wellbeing Queensland is a prevention agency and our role is to make healthy happen for Queensland. Our focus is obesity prevention, so we are targeting three key areas: nutrition, physical activity and well-being. Together we drive change so all Queenslanders have the best chance to live a healthier life, no matter who they are or where they live. When considering risk factors for chronic disease and obesity, we need to think about environments, living conditions, schooling, housing, transport, and the list goes on. These things that sit outside of health often affect our health the most. As we know, equity is different to equality, and the point this image makes is that equity is about removing the systemic barriers. It's not necessarily about more supports or services. It's about removing the barriers that create the need for those supports in the first place. Reducing health inequity is clearly articulated in the Health and Wellbeing Queensland Act. Addressing health inequities means addressing the social determinants of health, and for that we know we need others. We realise that an equity lens applied across the state and embedded well will minimise and ultimately eliminate the differences in people's life outcomes, health and others, differences that are unjust and avoidable. And so we've committed to delivering a Queensland equity framework that lists beyond health or specific population priority groups. The problem we are trying to solve can be demonstrated through age of death, and this train map highlights it brilliantly. Median age of death is generally younger the further you get away from southeast Queensland. The difference can be as much as 30 years. In Queensland we have some great initiatives helping some people beat the odds, but they may not ultimately change people's circumstances or long-term trajectories. The evidence of this is all around us and well known, including the overrepresentation of First Nations children in the child protection system, stubbornly low employment rates and income levels for people with a disability, and the list goes on. Because inequity is driven by a range of systemic factors that programmatic responses just cannot address. So this is about shifting those systemic barriers so that we change the odds rather than always trying to beat them. By taking a systems approach, others, and now Queensland, are finding new ways of achieving positive social outcomes. So the Queensland Equity Framework approach we have taken will consist of a number of components. A framework for ongoing action to drive equity in Queensland, which will provide a structure and approach that supports government and non-government agencies to consider and deliver changes that can make a difference for Queenslanders. Mechanisms for change, actions for immediate and longer term impact through macro policies and strategies, initiatives and service improvements. Tools to support decision making, data intelligence to understand action points, inform responsive solutions, and importantly track activity and impact over time. And partnership governance that builds the relationships and trust required for immediate and ongoing change across systems and sectors. We're not the first to do this. Over a decade ago, Scotland realised that inequity was responsible for thousands of premature deaths every year. So they decided to move upstream and try to address the fundamental causes, describing a wellbeing economy represented in their national performance framework here as image 1. New Zealand is the first country in the world to introduce a wellbeing budget. If you want to spend public money, you must prove it will improve intergenerational wellbeing. Their Treasury has developed the Living Standards framework to focus on things which matter to the well-being of New Zealanders, and that's demonstrated in the second image here. Closer to home, we've been learning from Vic Health, because we didn't need to start from scratch. With kind permission, we were able to use their framework, Fair Foundations, the Vic Health framework for health equity, and we used it as a starting point and we followed similar evidence-based methodologies. Fair Foundations described the drivers of health inequity, and we wanted to know if this was equally applicable to other sectors, other inequities. We've got lots of evidence that the social determinants of health have an impact on health inequities. But was there actual evidence to show these same drivers have an impact on inequities experienced in other areas, such as justice, education, housing? We felt like an evidence-based approach would help build a shared understanding of equity and its drivers, and this would be critical to supporting action. Health and Wellbeing Queensland partnered with the Institute of Social Science Research at the University of Queensland to review the drivers of inequity across 8 focus areas outside of health. These 8 focus areas were education, employment and work, financial vulnerability, housing, child development, child protection, engagement with the justice system, and domestic and family violence. What we found is that generally there's strong alignment between the drivers of inequity across this range of areas, including health. The research supported both the emphasis on the interaction between individual level characteristics and the context in which people are embedded. And importantly, it retained the idea of this concept of social position from Fair Foundations, which is that individuals are stratified in ways that influence how the other drivers affect them. The broader scope that we took beyond health required a greater emphasis on the structural and institutional characteristics relevant to the 8 focus areas, which led to the identification of 5 categories of drivers plus social position. Together, we've produced Towards a Queensland Equity Framework based on this research, this visualisation. These key drivers of inequity for the Queensland context give us a strong platform for ongoing cross-sector engagement and will form a strong evidence-based component of the final Queensland Equity Framework. And this is it continued. We are now deep in the middle of the next stage of the project, a systems analysis. This approach will help us see the connection between parts of the system and how they interact or don't interact, and the relationships between them. It will help us connect the needs and behaviours of people with the work and opportunities in the community to the systemic policy agenda. To effect change, a systems approach will help us rethink what we have and place equity at its centre, identify low-hanging fruit, short-term action, and provide a framework for ongoing action, learning, understanding and intervention. Importantly, this will seek understanding across sectors and at multiple levels. To bring precision to the mix, we need data. Again, investing in the expertise of the Institute for Social Science Research, which will help provide a detailed systems insight related to equity in Queensland, an understanding of the system's components, and a way to measure the impact of the investment into the system. Importantly, to achieve equity outcomes, we need to convene partners to work together and build the authorising environment for the work. This partnership governance approach for systems leadership is a critical part of this project. We've established a partnership governance group, which is engagement across 25 Queensland government agencies, all public sector departments, and 3 commissions. It is a mechanism for building shared understanding and empowering agencies to shift their systems towards their goals in a way that reduces inequity. We also recognise the importance of ensuring that our work reflects community priorities and incorporates the voice of lived expertise of those who will benefit or be impacted the most. A community governance group is being formed to provide this opportunity for us to learn from the unique perspective of people with lived expertise and incorporate that into the design and development of the equity framework. We're also working with critical friends, networks, NGOs and advocacy groups to build strong partnerships for change. We're currently in the design and development phase, but we have an eye to what is needed to bring this work to implementation, laying the groundwork for ongoing action and leadership across government and with key partners in community, sector and industry organisations and with people with lived expertise. We'll have those identified key mechanisms for change, a package of actions that can be taken to support equity in Queensland. Some of the best mechanisms will cost little, however funding commitments may be needed for some. We imagine this could include new or amended legislation policy, commitments to develop new strategies or plans, new or expanded initiatives, programs, services, and governance and monitoring, including indicators and targets. By taking a broader equity perspective, including, but beyond health, this project demonstrates Health and Wellbeing in Queensland's commitment to supporting Queensland communities to have the best chance to live a healthier life, no matter who they are or where they live. Thank you very much.